Good afternoon. This is Friday, April 10th. I'm Gary Pace, the Public Health Officer for Lake County, giving the daily coronavirus update. So in the United States now, there's 460,000 cases with 16,000 deaths. California has 20,000 cases with 550 deaths. Sonoma County has 141 cases. Lake County has 4 cases now. I think the thing that's most striking about these numbers is that the rise in California and in our general area is much slower than was anticipated, and I think that's because of all the hard work everybody's doing to shelter in place. So thank you for taking care of that. So we've had our 4th case now identified in Lake County. This was somebody who's a household member with one of the other cases. So we still do not have any evidence of community transmission. I wanted to talk a little bit about what we do when we identify a positive case. And the public health nurses are really the front line here of protecting the community in an outbreak like this. We only have really 6 public health nurses in our department, and some of them are working part-time. So you can bet they're working really hard right now. They've been doing a lot of preparation to get ready for when we do start seeing cases, because they're really the ones who are identifying people that have been in contact with the person who's infected and also helping support them in their isolation. So just to review what happens, so we would get a test result that comes back positive, and the nurse will contact that person, even if it's the evening or weekend, to check in with them, to see how they're doing, to try to identify when they got contact with the infection, how they're doing with their symptoms, and also any contacts they've had during the period when they could have been infectious, any kind of help they need with support, with home isolation. If they're having trouble getting food or something like that, they can probably help them make contacts with resources. So I think the important thing here is that we're really trying to slow the transmission through the community. And the way we do that is by containing the sources of infection when we can. And the public health nurses are really the most important part of that. And I want to just take this opportunity to thank our hardworking and unsung public health nurses. So thank you.